We formed Mesh of Mothers out of a need. We found that during that time, during the pandemic, a lot of Black moms like myself felt very isolated, felt a lot of disillusion, a lot of irritability. They were experiencing a lot of postpartum mental health that they didn't even recognize. And one of the things that came out was a need for community, a need for them to be around other mothers who they can congregate, share their experiences of successes and of challenges within motherhood, and feel seen and heard within that process.
One thing BIPOC mothers should know is they have resources available for them. There are resources whereby they're going to go into those spaces and not have to explain themselves in whatever way. Being able to go on a database whereby they can have like practitioners and providers without having to go through a deep search on Google is available for you.
We do our due diligence by checking to make sure that all the practitioners on there are legitimate and they say they are who they say they are. So we do our vetting process and then we get them on the database.
This is why the resource that is the BIPOC database is so strengthening, not only for the people who need it, but also the people who provide it. Because I have been fighting tooth and nail for the past year since going official with my duties to get recognized, to be in spaces where people won't cringe at the work that I do and see the importance of sexual and reproductive health.
It's a living document, however, it's something that can be accessed tomorrow, right? And so we're hoping that all hospitals, all birthing centers, all medical centers would have access to this so that when their patient comes in and they're looking for, let's say, a Black mental health therapist, they have access to that. If they're looking for an Asian doula, they have access to this. It's all about increasing options and accessibility to culturally relevant resources.
Pregnancy, motherhood alone is already stressful. Let's help relieve that stress.